Time passes by with a multitude of changes, and every day can pass.
All new places, different faces in a world where changes everywhere you turn.
Find a friend you can rely on.
Hold the helping hand that shares. Keep the company that will truly care.
Medicard.
The company that doctors build.
Medicard.
The caring and the expertise. We're here
To serve you through the years.
for all that life may bring. We're here to help your family live in health and grow your dreams.
Medicard.
Doctors build,
Medicard.
the caring and the expertise.
Finding
Medicard, Medicard, find the healthcare that you need
in Medicard.
Oh, right. The letter of approval for my eye checkup. I think that came in yesterday. Let me check the app. There it is. I can go see my doctor now. I swear, if I didn't have a healthcare plan, I wouldn't think to look out for myself.
It's been really hectic lately at the store, and we almost didn't have time for my employees' annual checkup. Good thing Medicard does on-site testing. We can continue with business as usual, and my employees don't have to do more work to get their health checked. Thank God for Medicard.
used to be able to do it all. But I'm too old to spend my time on long queues. That's aging for you, I suppose. Being able to do these tests at home brings me so much comfort.
We've come a long way in building a healthcare system that lives up to what we aim to be, to serve as the lifeline of our clients, a bridge to health. 35 years, fueled by a desire to make healthcare affordable and accessible to everyone, inspired by the trust of our clients. We want our members to feel like they can enjoy their lives to the fullest, that they can give their best shot in pursuing their aspirations because they are in their best of health, and that they can take comfort in knowing that the healthcare they need is just within their reach. Thank you for entrusting your health to us. It's what we're here for.
Okay, good afternoon, everyone. Welcome to Medicard's webinar. So, I am Dr. Pauline Faustino, Manager for On-Site Clinic Management and Health Promotion Services, and I will be your host this afternoon. This webinar is a rightful culmination and celebration of the National Lung Month. So we observe the National Lung Month in August to encourage everyone to actively participate in keeping a healthy body and avoid diseases, especially that of the lungs. As DOH promotes it, let's support each other to have healthy lungs for a healthy Philippines. So you will see in the next screen what we will expect from this webinar. Okay, so we will know why August 19 has been declared the National TB Day, the importance of chest X-rays, especially in ATO, not to mention PEMEG. So also, what is tuberculosis as an infection, and how can we treat it, prevent it, and control it? So we invite those watching through our Facebook page to also join us in Zoom. We will provide the link in the comment section. I won't keep you waiting. Allow me to introduce our speaker for today. So the speaker is a graduate of physical therapy from the University of the Philippines, Manila, and a doctor of medicine from the Pamantasan ng Lungsod in Manila. She trained in Hospital ng Manila Medical Center and Armed Forces of the Philippines Medical Center. She worked as a lecturer of Sultan Review Group for the Physical Therapy Local Board Exam and a medical officer in Batanes General Hospital. Currently, she works as a medical officer in Cainta Municipal Hospital and company doctor around Metro Manila. She is a regular speaker for our wellness webinars. So please welcome our speaker, Dr. Marguerita May Palparan, or as we call her, Dr. Miss.
Hello and good afternoon, everyone. So before I start, I would like to share my screen first, and we're going to talk about tuberculosis. It's here in a tropical country here in the Philippines. It's always been a timely health topic, because tuberculosis is always here. It's always present. In fact, it's like a silent trending. So before people became aware of their health, before the COVID pandemic, where health is trending, um, people have been disregarding this disease, or there's misconceptions about this disease. And I think we should use the awareness of people with their lung health to also promote this very how should I call this? I wouldn't say popular, but infamous disease, tuberculosis. So this is going to be the flow of my discussion. Don't worry, we're not going to discuss it like a doctor. We're going to discuss it in a way that everybody can appreciate it. So let's first let me give you an introduction case. Okay, so maybe some of you know this kind of patient, not necessarily the specific patient, but maybe you're familiar with the for example, an example that I have here. Miss Melba is a 52-year-old female who is a dressmaker, and she came to the clinic with a history of 6 months or cough. 6 months of cough, or basically more than 2 weeks of cough with phlegm. So may nalalabas siya, may nadadahak siya na plema. And then that's also accompanied with loss of appetite or anorexia and weight loss, unintentional weight loss. She had no previous history of any lung disease. Her chest x-ray showed infiltrates over right upper lung field. Her sputum exam is positive. Sputum exam for AFB or acid fast bacilli is positive. What is her diagnosis? So in med school, we usually have this. So the teachers, whatever the topic is, the teachers would give us sample cases that we can, so that we can understand the disease better. So they're giving us the story first before they give us the details. So parang chismis, and we are more receptive if it's like that. So that's why this is my technique, to give you a story first. Somebody who has chronic cough, so cough for more than 2 weeks, weight loss, loss of appetite, and then there's something in her x-ray, and then they analyzed her sputum and it turned out positive. Her diagnosis is obviously the topic for this after forms of tuberculosis, which we might be able to touch later on. So when you say etiology, what is the causative agent of this disease? Mycobacterium tuberculosis is the name of the bacteria that causes pulmonary tuberculosis or tuberculosis in general. And if you look at it under the microscope, it looks very simple. Napakasimple lang niya. It's just one straight rod. Hindi siya katulad ng COVID where it has spikes. So it's like a punk virus. This one is just a boring stick bacteria rod, a rod that looks like a bacteria that looks like a rod. But do not be mistaken. Even though this may look simple, this agent, this bacteria is very strong, I would say, or susceptible. I know, not susceptible, but resistant to a lot of antiseptics. So Mycobacterium, the family, under it, it has 70 species of mycobacteria. So different kinds of other pinsani Mycobacterium tuberculosis. But the two most popular ones are Mycobacterium tuberculosis and Mycobacterium leprae. So yes, tuberculosis and leprosy are parang cousin sila when you talk about that. They're like cousin diseases because they come from the same bacterial family. Diba? So, tuberculosis is caused by Mycobacterium tuberculosis with other subspecies such as M. tuberculosis, Africanum, bovis, and microti. You don't need to know about that. But basically, with M. tuberculosis, the principal host is us humans. And then the cousin is the M. leprae, which causes leprosy. That's why if you are familiar, if maybe you know somebody who has had leprosy or you know somebody who has had tuberculosis, there are some medications that are the same. So, like for example, rifampin, yun din ang iniinom nila sa leprosy. So, because they came from the same family. Okay, so what's the characteristic of M. tuberculosis? So it's a survivor. That's how I would like to put it. It's a very strong survival. It's resistant to drying. It remains alive and virulent in dried sputum for up to 12 years. Okay, if there's no sunlight, the sputum remains viable up to 6 to 8 months in dried sputum. Okay, so the bacteria remains viable, alive, possibly reproducing as well for up to 6 to 8 months in dried sputum if there's no sunlight. Okay, droplets adhering to dust are infectious for 1.5 weeks, 1 to 1.5 weeks. So meaning, the so with Asians, I don't want to generalize, but this is actually a habit. So not just Filipinos, but Asians in general, like Chinese or so it's our habit to spit on the road, diba? So that can also be a way to spread the bacteria. Kasi the bacteria can remain alive in dried sputum, especially if it's not being touched by sunlight. Okay, and once that bacteria joins the dust and it's on the air, somebody can inhale it. Somebody with very weak immune system, they can actually have it. Diba? So yun. So that's why in tropical countries like this, you can say that for some cases, tuberculosis might be in the environment. Okay, in some cases. Okay. So it's resistant to the effects of chemicals, so therefore it is difficult to disinfect. If you want to disinfect tuberculosis, make sure you use 5% solution of phenol. Do we need to remember that? Not necessarily, because this is our guidelines in the hospital when we're trying to disinfect, for example, a place wherein the patient has tuberculosis or different another kind. So there's a lot of kinds of tuberculosis. So we use certain disinfecting chemicals. We don't just use anything. Okay? So, however, so kahit na resistant siya to a lot of things, it's a survivor, it's also susceptible to several factors, like number one, heat. So, I don't know if you guys have heard of autoclave. That's where parang pinipressure cook mo yung mga instruments sa hospital. So, parang pressure cooking siya to kill the bacteria. So the TB bacteria is susceptible to that because that's heat and pressure combined. And then there's pasteurization. So it's a special way to sterilize the milk, and so yeah, so basically the milk. Kasi you can get tuberculosis through cow's milk, pero that's a different story naman. That's more of GITB. So maybe I will be able to touch that later. And then it's also susceptible to UV light. That's why, as I said earlier, if the sunlight is not touching the spit on the ground, the bacteria can remain viable for a longer period of time. Whereas if there is sunlight touching it, it can die. So it's susceptible to UV light from the sun. Okay. So it's destroyed in direct sunlight within 2 hours in cultures and 20 to 30 hours in the sputum. Okay. So I mean, I still do not encourage spitting, but spitting in a place that's exposed to the sun, there's chances that the bacteria may have been killed already. Okay? So transmission and pathogenesis. So how does it produce a disease in our body? How can we have it, and how does it make us sick? So that's basically this. So transmission is you can pass it on to another person through the main mode of transmission, which is droplet transmission. Okay. So when you say droplet transmission, I call them microtalsik ng laway. Kasi pag sinabi mong talsik ng laway, parang drop yun eh. Drops of saliva in the air. Pero pag yung maliliit na talsik na, some of them are not even visible by your naked eye, that's already called droplet. And yes, it can contain the bacteria. So that's the major mode of transmission of tuberculosis, the bacteria, droplet transmission. So for example, there's somebody who's coughing, sneezing, or simply talking to you, and they don't know they're infectious and they have tuberculosis. You may not know it, but you might be inhaling their droplets as well. So parang, di parang na-inhale ko yung laway niya. Actually, yeah, you just don't know it. Parang it's the same mode of transmission as COVID-19. Actually, droplet transmission is one of the major modes of transmission for respiratory infections. Okay? So yun, isa yan, droplet or airborne. Pero when you say droplet, there's only a limited distance because syempre talsik yan ng laway. So eventually the gravity will pull it down. Whereas with airborne, lumilipad siya. Okay? So mas malayo yung maaabot ng airborne. With tuberculosis, it's mainly droplet. When you say droplet, nandyan yung 2 meters na distance na limit. Okay? So kunyari may kasama kang may tuberculosis pero 5 meters away siya sa'yo, you're sure na hindi ka naman mahahawa doon. Kasi hindi naman siya lilipad ng ganun kalayo. Okay? So yun. So droplet, 2 meters lang yung kaya niyang at most na i-travel. Okay? And then after that, pababa na kasi din yan yung trajectory. So inhalation of a droplet nuclei with the TB bacteria is the major mode of droplet transmission. And so how do you have the bacteria in the droplet? So whoever is sick or infected, it releases the droplets in the air through sneezing, coughing, or simply talking or screaming. Diba? You're already releasing some of your droplets. Okay? So, and then somebody who is susceptible inhales the droplet and then it goes inside the lungs. Actually, Mycobacterium tuberculosis is a very strong bacteria that only one organism is enough to establish infection, especially if that person has very weak immune system, like the super young and the super old. Okay, so what happens inside our body? How can it make us sick? So once you inhale the droplet nuclei from the air, it goes inside your airway, it goes inside your lungs, so it goes into the alveolar space of your lungs or the sac of your lungs. And then there are macrophages there. Those are they're like police officers, but they're cells. Okay, so para siyang police na cell, they engulf or they eat the TB bacteria because they know it's the enemy. So in order to get rid of the enemy, they eat it and they try to digest it inside them. Okay. So if your immune system is strong enough, meaning your macrophages are also strong enough, they can contain the bacteria in the form, contain and form tubercles. So they can contain the bacteria in the form of tubercles. So parang siyang capsules inside your lungs that contain the tuberculosis bacteria. And that capsule is made by your macrophages. If your macrophages are strong enough, so those are immune cells na kumakain ng kalaban na viruses and bacteria. So if your macrophages are strong enough, they can form a capsule that will contain the bacteria there, and the person may not get sick. Okay? So hindi nila mararamdaman may symptoms sila. Okay? So the bacteria, however, it can go another way. So the macrophage is able to contain it. Person is not sick. Person is asymptomatic. Or it can go the other route, which is the bacteria destroys the macrophage and it spreads to the sputum. So, tinry siyang kainin ng macrophage, but the macrophage cannot contain it. So, the bacteria destroys the macrophage and the bacteria goes to the sputum. It goes to the alveolar space of your lungs, goes to the sputum, ma-stimulate, ma-irritate yung airway mo, uubo ka. Okay, ma-stimulate, ma-irritate airway mo, so you tend to produce more sputum. And pag marami ka ng sputum, may irritate yung airway mo, uubo ka. When you cough, then you release more bacteria in the air. So that's what happens. So yung isa, ma-contain siya. Yung isa naman, natalo niya yung macrophage and it stimulates production of more mucus, kaya nagkakaplema, and uubo ka. So that's when you have the symptom of coughing. Diba? Kasi when there's a stimuli irritating your airway, you cough. That's a reflex. So that's one way. So you're asymptomatic, no symptoms, or you develop symptoms because your immune system was not able to contain it. Okay? And then, so that is the pulmonary pathway of tuberculosis. There's also the extrapulmonary pathway, which is through blood circulation. So extrapulmonary hematogenous dissemination, basically the spread of the bacteria through blood. Yun lang ibig sabihin no. Napaka-scientific. Extrapulmonary hematogenous dissemination. Wow, I feel so smart. It's basically spread of the bacteria outside the lungs through the blood. So kumalat po yung bacteria through your blood, kumalat siya outside your lungs. Okay? So where would it go? It would go to the other organs of your body. That's why pulmonary tuberculosis, although it is the most common, there are also other forms of tuberculosis. Isa sa mga, I think I have a list later kung ano yung mga common. Pero for example na lang, have you ever met somebody who has Pott's disease? Yung parang na-paralyze sila kasi nagka-TB sila sa gulugod nila or sa spine nila. So that's an example. Okay? So that's one way that you can have extra pulmonary tuberculosis through spread in the blood, through the blood. Okay? Another pathogenesis or another pathway to cause disease or sickness or symptoms is eventual reinoculation of the lungs. So it serves as the origin of reactivation. So ibig sabihin, pwedeng yung na-contain na tubercle, pwedeng eventually masira siya tapos mag-spread din siya and eventually it will cause disease. And paano nangyayari yon na na-contain na siya ng macrophage? So they're supposed to be just there. They're not supposed to cause any disease. Well, when your immune system goes down, the tubercle or the capsule that's formed around the bacteria also weakens and the bacteria is released and it goes out into your system, your lungs, and you cough it out. So nagkaroon ka din ng sakit. You also develop symptoms. So yun yung secondary TB. Okay? It can also, so parang yun, parang reactivation siya kasi yung first time, di mo masyadong halata. Yung second time, yun na talaga yung may TB ka. Okay? Yung talaga may symptoms ka. Okay, so risk factors and prevalence. So, do I have certain risk factors that makes me more susceptible to TB? And how frequent, how common is TB here in the Philippines? Okay? So the risk factors to infection of tuberculosis is divided into three: the infectious patient, so the one that has tuberculosis, the host factors, the one who will receive the tuberculosis, yung nahawaan, and the environmental factor. So for the infectious patient, the risk factor is how infectious is that person. How many droplets are they releasing? So simple lang naman yan. Yung taong bang ito, hatching ng hatching, ubo ng ubo, versus yung tao ba na to na hindi humatching, hindi umuubo, or konti lang yung ubo niya, or he's manifesting with other symptoms like, let's say, kulani or lagnat. So, who do you think is more infectious? Yung taong umuubo, maghahatching, o yung taong meron lang kulani, yung naglalagnat lang, pero wala namang, minimal lang yung ubo niya. Of course, the person who is more infectious is the one that's actually releasing it in the air. Yung ubo ng ubo, hatching ng hatching. So that's one risk factor. Exposure to that kind of person that may nagkaroon na nga ng term, super spreader, di ba? Kasi ubo ng ubo, hatching ng hatching. Okay, and then also, how many bacilli or how many of the bacteria is included or released through his sputum when he coughs. Okay, so that's a risk, another risk factor on the side of the infectious patient. On the side of the receiver or the host, okay, ang pinaka-risk factor dyan to developing tuberculosis is your immune competence. You can have, you can, pwedeng saglit mo lang nakasama yung taong may TB, but since your immune system is very, very low, you eventually develop it. You eventually have it. Okay? So yun siya. Or, kahit na na-expose ka sa taong may tuberculosis, umuubo na sa harap mo, but your immune system is very good, it's competent enough, you still don't develop tuberculosis. That can be. In fact, I would like to put myself as an example. So, little did I know that all my family members have tuberculosis. Okay? So, how did I know? It was an incidental finding. I think we were going abroad and we were required to do a chest x-ray. And it turns out, so we're 5 in the family, my parents and my 2 brothers. It turns out all of them has yung tinatawag na tama sa baga. So lahat silang 4 may tama sa baga except for me. 'Di ba? And isn't it ironic na ako pa yung doktor, ako pa yung walang tama sa baga, samantalang I'm dealing with people who are TB suspects or actual TB patients na hindi pa natitreat. 'Di ba? So all my family, my brothers, my parents, they underwent treatment, 'di ba? So host factor, immune competence is very, very important. Okay? It will protect you from tuberculosis. And also, why is it important? Because there are times na the person don't have any symptoms. Or maybe the person has symptoms pero hindi mo alam kasi minimal yung symptom niya. 'Di ba? O minsan, TB is very common in the Philippines. Sa totoo lang, it's very common because we are a tropical country. Yan ang favorite environment ng bacteria. So yun. So risk factors to infection of okay. So additional risk factors, so sabi ko 3 aspect 'yon, 'di ba? The infectious patient, the host or yung mahahawaan, and of course the environmental factors or exogenous factors. So nandyan yung number and size of the droplet nuclei. There's the duration of exposure of the susceptible person to the particle density. So an example of that is when we're trying to trace. So for example, a child develops primary complex, which is the pediatric version of tuberculosis, pulmonary tuberculosis. So they have primary complex. So we try to assess who is with the child most of the time. Okay? So kasama na rin dyan yung kung nag-aaral yung bata sa school, what is the health status of the teachers? Because if your child is already going to school 8 hours or 9 hours in a day, then that child is exposed more to the teachers than to the people in the house. So we also investigate what's the health of the people around that person, 'di ba? So yun, so kinisip namin duration. Kasi pag mas matagal mong kasama, mas mataas yung chance na mahahawa ka. Okay? So yun, sabi nga nila, I remember, although I don't know if this was written in a textbook, pero parang one of the practical ways to analyze and also pacify ourselves. Kasi kunyari, meron kaming tinreat na TB patient. And back in the day, hindi pa uso yung mag-mask sa ospital. Mag-mask ka lang pag ikaw yung may sakit. So, for example, somebody comes in, TB patient siya, tapos mag-aalala na kami, oh my gosh, na-expose ako. Pero the consultation happened for like 15 minutes. So our seniors would be like, para, unless your immune system is very weak, para masabi mo talagang may significant exposure ka, dapat ilang oras yan, 8 hours, tas araw-araw. Pero kung 15 minutes lang, nagpakonsulta siya sa'yo, tas maganda naman immune system mo, maybe there's a chance na hindi ka naman mahawa. So don't panic, but observe yourself. Yun yung advice sa amin ng senior namin. So na-mention niya yung 8 hours, 'di ba? So nagbigay siya ng number. Air circulation and ventilation. Okay. So if the place that you're working at or the place that you're at has no ventilation, then there's chance that transmission of tuberculosis is very high. Kaya, kunyari, may batang may primary complex, tapos nag-aaral siya 8 to or 9 hours a day sa school niya, tapos yung classroom niya is air-conditioned pa. And when you say air-conditioned, that's not necessarily ventilation. Pinapalamig lang yung hangin, but it's not really ventilation. Ventilation is when you let the outside air come in and the inside air come out. So dapat meron talagang exchange ng hangin. Like you open the windows, you open the doors. But if it's just air conditioning, nakulob din yung bata, 'di ba? So important din talaga yung status ng mga taong kasama nila sa school, not just the teacher but also their classmates as well. So yun, versus kunyari sa bahay, nasa sala kayo, nakabukas naman yung bintana, well ventilated siya, 'di ba? So yun. Okay? So prevalence of tuberculosis, how many people have tuberculosis? So according to WHO, around 1 million Filipinos have active tuberculosis disease. National Tuberculosis Prevalence Center of 2016 states that there are 760 Filipinos that have PTB. Pero I think that may have increased because of the COVID pandemic. So nauso yung the reason why there's an increase is because there's an increase in health awareness, health consciousness of the people, health awareness. Tapos naging common yung x-ray, and sometimes tuberculosis is detected incidentally through x-rays. Okay? So yon, according to the study also, 1 million Filipinos have tuberculosis in any other form. Yes, other forms of TB, meaning TB in other organs, not just the lungs. Okay, so there's based on a 2016 study, there is no decline in the prevalence of TB from 2007 to 2016, meaning whatever health methods that our government was doing at that time, 2016, and prior to that, is not that effective to lessen the prevalence of TB from 9 years before. So parang nagplateau siya. However, because of this increase in health consciousness of the people, increase in the healthcare, the way the healthcare system is being run, improvement in the way the healthcare system is being run, I would hope to expect that we are more aggressive when it comes to treating TB na. Okay. Signs and symptoms. So how would you know that you have tuberculosis? What are the symptoms that you need to watch out for? Okay, so for primary complex, primary TB, so this is tuberculosis in kids up to 4 years of age or immunocompromised people. When you say primary TB kasi, mahina yung immune system mo, the bacteria goes inside your lungs and your macrophage, your immune system is not able to contain the bacteria. So right then and there, you develop signs and symptoms such as fever, perspiration or night sweats, runny nose in the morning or colds in the morning, cough, may it be with phlegm or not, loss of appetite or anorexia, weight loss that is unintentional, and then you came out positive on the skin test, which we call PPD, and there is abnormality in your X-ray. So again, yun yung sinabi ko kanina, di ba? 2 ways kapag naka-inhale ka, ma-contain siya or kumalat and you develop symptoms. So primary TB, kakalat yan and you develop symptoms. So sa unang inhale mo, magde-develop ka na ng disease because your immune system is not strong enough to contain it in tubercles. Okay? So kaya siya primary kasi unang pasok, primary symptoms agad ang lalabas. Hindi siya yung secondary or saka na yung symptom. That's why it's called primary. Okay? So symptoms, ayan, fever, night sweats, persistent cough. When you say persistent cough, that's more than 2 weeks. Okay? So 2 weeks yung keyword natin dyan. Pag inuubo kayo, ang deadline nyo, 2 weeks. 2 weeks dapat, wala na to. Pag 2 weeks meron pa, pupunta na ako sa doctor or sa TB dots. Okay? Bloody phlegm. Okay? So you're coughing out blood. And then there's chest pain or shortness of breath because your lungs is not normal or not working right. Now, the other type of tuberculosis is the secondary tuberculosis. The secondary tuberculosis or the adult type is what we call reactivation. Okay? When you say reactivation, kasi possible na naka-inhale na sila ng TB noon. Okay? Pero because their immune system is good, established, the immune system form tubercles to contain the bacteria, so you're not able to develop symptoms right then and there. However, it becomes reactivated when your immune system goes down. Like for example, you get sick, 'di ba? Or nagpagod ka, nagpagod ka, you're not able to sleep well on time. Diba? So your immune system goes down. When your immune system goes down, that tubercle that contains the TB bacteria, it gets destroyed. And the sleeping bacteria gets reactivated. Kaya siya reactivation TB. And that is secondary TB kasi yung symptoms, lumabas siya sa kana. Okay? After several, yung iba nga years na nagkaroon ng symptoms, 'di ba? So yon. So if you have reactivation TB, bumagsak immune system mo, na-release yung tubercles, you start to develop symptoms. The symptoms also include almost the same thing as the primary TB. Fever, night sweats, weight loss, anorexia, general malaise or weakness, cough, coughing out blood, what we know, it's also what disease or Rasmussen sign, and difficulty breathing. Okay? So parehas lang actually, halos parehas lang. However, according to what I know and my experience with primary TB, common din pala sa kanila sa mga bata na mag-develop ng kulani. So, hindi nila na-contain yung bacteria sa lungs. So, yung kulani ngayon, double time silang gumawa ng immune cells. Kaya may kulani yung mga bata. Okay? So, yun. So, primary TB, usually may kulani yan. So, may bata na pumunta sa akin complaining of kulani, nodules sa leeg, sa may shoulder, sa may chest. Iniisip ko talaga agad, pa-x-ray natin. We need to rule out primary TB. Sa matanda, bihira yung may kulani. Although, meron pa rin. Meron pa din po. Okay? But usually sa matanda, ang symptom talaga is yung chronic cough. Question, what if, for example, I inhale the tuberculosis, but my immune system is strong enough that my body is able to form tubercles to contain it. My immune system did not go down. How will I know that I have tuberculosis? Because I never manifested with symptoms because the bacteria is still there in the tubercles. My immune system never went down. The bacteria has been contained ever since. What do I do? Would it be detected? How will I know? What should I do? What will I feel? Ganon. Actually, that's the example of my youngest brother. Di ba sinabi ko, halos lahat ng family ko, ako lang ang wala, nagka-TB. So my youngest brother, he did not know he has tuberculosis. He had no signs and symptoms. He wasn't losing weight. He was actually chubby, very strong. Okay, very strong in his prime. Yan. Pero yun nga, since we have to undergo chest x-ray as a requirement for a travel visa, nakita siya na merong scarring or tubercle or capsule or kung ano man tawag doon sa upper lungs niya. He had no symptoms but his x-ray came out abnormal. There was something there on the upper lungs. So yun yung tinatawag na incidental finding. So ibig sabihin, pwedeng wala kang symptom pero madidetect pa rin siya through x-ray. Okay? So with my brother, he didn't have any symptoms, but because there was something in his x-ray, they did the test. They did the sputum test. It came out positive. He started the medication and he finished the medication without even going through the reactivation phase of TB. Kasi kahit na-contain na, ininuman na niya ng gamot, ng TB meds. Okay. Other sign or symptom of TB is hemoptysis. So yan yung sensationalized symptom of tuberculosis, 'di ba? So nandiyan yung dati kasi tuberculosis was considered the HIV of the 1800s because there was no cure for it back in the old days. So parang yan yung AIDS nung 1800. And the reason why it's sensationalized is because of hemoptysis, which is when you cough up blood. Okay, so you cough and then there's blood coming out. Syempre nakakatakot nga naman talaga 'yun. Okay? But the seriousness really depends on the cause of bleeding. So, hindi porkit merong you're coughing up blood, that doesn't mean you already have tuberculosis. You still need to go tests kasi there are also other diseases that can exhibit hemoptysis. One very popular disease, for example, is COVID. Diagnosis. So how would you know that um so when you're suspecting na, oh, I might have tuberculosis, what should you do? What's your next step? Okay, so if you think you might have tuberculosis, the next step is to consult a doctor. Do not overdiagnose yourself. Consult a doctor. You can consult your company doctor, you can consult your family doctor, kahit general doctor, kahit na neurosurgeon yan, they will know somebody, or they know, almost all doctors know the system of the TB dots. Okay, so yon. So when you consult a doctor, of course, you will undergo diagnostic procedures, because we need to find out, is it really tuberculosis? Okay, because there are also common differentials or other diseases that may appear like tuberculosis. However, I want to enumerate or differentiate them from TB so that you will not be mistaken. So common cough, that's yan yung minsan joke nga na parang pag malala yung ubo mo, ay naku, nagkaka-TB na ako, 'di ba? Parang tumatahol na yung ubo, may TB na ako. But common cough, it differs from TB because it differs from TB through the duration. With common cough, the cough lasts for less than 2 weeks. So the cough resolves before 2 weeks. With TB cough lasts for more than 2 weeks. So it's chronic cough already. Okay, another common differential, the papagkamalan ng TB is the flu. Flu or systemic viral infection. Okay, that's fever, anorexia, sometimes with temporary weight loss, diba? So the difference between flu and TB fever is that TB fever occurs intermittently for weeks. When I say intermittently, parang either every day at a certain time of the day may lagnat ka, or ngayon may lagnat ka and then mawawala siya for 2 days, tas after 3 days babalik na naman siya, tas mawawala siya for 1 day and then babalik na naman siya, and then yung ganon. So it's intermittent, it has no pattern, it's on and off fever for weeks. Okay, for weeks. Ang key number natin dyan is 2 weeks. You're having intermittent fever that you never really recovered from, and it's been going on for more than 2 weeks already. Whereas with the flu fever, it's self-limiting and it resolves before 2 weeks. Usually, before nga 1 week, magaling ka na sa trangkaso diba? So that's the difference, 2 weeks. Cancer, another common differential of TB, because they both show rapid weight loss. And these two diseases are what we call in the medical world as the mimickers, the great mimickers. Kasi kakaiba yung mga symptoms nila that they can actually mimic other diseases. Okay? So ibig sabihin, yung complications that arise from cancer and TB, almost the same. Kaya nagiging common differential siya. Plus yun nga, yung papasok tapos ang payat-payat. Here in the Philippines, when we see somebody who goes to the clinic and is emaciated or payat, we consider tuberculosis. However, in first world countries, somebody goes to the clinic and they're emaciated or super payat, the first thing that crosses their mind is cancer, because tuberculosis is not common in first world countries. So that's why cancer is also a common differential. So let's say, oh, I have TB? Consult your doctor, and the doctor will run some tests. So they will do the initial interview, physical exam, auscultate for your lungs, papakinggan nila with your stethoscope and all that. So all this information will contribute to the proper diagnosis of the patient. So now the doctor might run some tests or will run some tests, and these are the common tests done for people with tuberculosis or to diagnose tuberculosis. There's the skin test, chest x-ray, CT scan, sputum exam, and blood exam. So the skin test is what it looks like. They will inject a fluid on your forearm, and then they will mark the induration. When you say induration, umbok, yung umbok, they will mark the induration or yung umbok. Okay, and then they will ask you to come back 2 to 3 days later, and they will check if the induration, what do you call that? If the umbok or the induration goes beyond the borders of the original induration. Ibig sabihin, lumaki po ba yung umbok? Pag lumaki yung umbok, then that's when nagpa-positive. But there is a measurement. Okay? So, yon. So, ang measurement dito sa Philippines, pag lumagpas ng 1 centimeter, considered positive na yan for TB. But in the US, if you do the skin testing, 5 millimeters or 0.5 centimeters pa lang, pwede na mag-positive. Kasi sobrang baba ng cases doon, exposure is not that much. Whereas here in the Philippines, exposed talaga tayo sa tuberculosis. So we have this, what do you call this? Initial immune reaction, or the hypersensitivity and A-type hypersensitivity to tuberculosis because we are exposed to it because it's very common in our country. So kapag ka pagbalik mo, after 2 to 3 days, they will measure the induration or yung umbok. If it's greater than 1 centimeter or 10 millimeters, it's considered positive in the Philippines. But if it's only 7, 8, 5, negative pa yan. But in the US, pag mga 7, 8, 5, pa-positive na nila yan. Okay? So the reaction is measured 48 to 72 hours or 2 to 3 days. And you measure the induration or yung umbok, not the redness. Kasi some people, they make a mistake na, uy, positive. Pero pag tinignan mo, mapula lang outside the borders, but it's still flat. You don't measure that. You measure yung umbok. Okay? So yun. So what does skin test do? Skin test basically can test or show us if the person is exposed. Okay? So yun siya, exposed or aside from exposed, if that person has been infected with it, with tuberculosis. X-ray. So chest X-ray, the most commonly used, most effective screening tool to detect tuberculosis is the chest X-ray. So we do different types of views. The initial view is usually postero-anterior view, which is the, back to front yung daan ng X-ray. So diretso lang yan, walang anggulo. Sometimes we see something suspicious. Oy, ano ba to? For example, ano yan? Pero you're not so sure because there's a bony structure there that's blocking your sight or blocking that lesion. So we ask for a second view, the apicolordotic view or APL view. So in this view, they tilt the X-ray camera or machine so that you will have a better picture of the upper or the apex of the lungs. Okay? Common question that I get from people na, Doc, kaka-X-ray ko lang yung PA view, bakit papa-APL? Hindi ba kaya masama na yan kasi may expose na ako sa radiation? My answer to that is no, it's not, because the radiation coming from the X-ray is very, very small, that it's negligent na pag nagpa-X-ray ka, walang mangyayari sa'yo. Unless magpa-X-ray ka 1,000 times in a year, then doon mo mararamdaman yung radiation ng X-ray. Pero kung kaka-X-ray mo lang, na X-ray ka ulit, dalawa lang naman yan, that's not dangerous. It's okay. Okay? So sometimes we ask for a second view, which is the APL view, when we feel that we want to visualize the upper part of the lungs better. Okay? So the good thing about X-ray is this is one of the conventional screening tests for tuberculosis. It is recommended because it's cheap and it's almost everywhere. And not only that, it has been proven to be an effective screening tool for tuberculosis. As I said, when I want to go back to the case of my brother, he didn't know he had tuberculosis if not for the chest X-ray that we did for the visa application. Diba? So it's a very effective screening tool to detect for tuberculosis, especially for those that are not manifesting with symptoms. Okay? However, chest X-ray does have its disadvantages. Number one is you cannot really diagnose nor classify what kind or what level of pulmonary tuberculosis to the X-ray. You cannot detect the actual location. Let's say you see a tubercle or you see a capsule, you see a mass or a bleb. You cannot really identify the specific location with the chest X-ray. Chest X-ray is only good for detecting possible tuberculosis. Now, if you are suspicious, because in the chest X-ray, there's some scarring on the upper part or in the area. So basically, the lungs looks like, the X-ray looks like tuberculosis, diba? So you will use that as a tool to further diagnose, give you a direction on how you're going to diagnose your patient. 'Di ba? So, ganun po siya. X-ray will help you spot tuberculosis. But to further diagnose or figure out the details, you need to do more extensive testing. Like for example, chest CT scan. Nakita mo there is a bleb. For example, here, uy, there's something here. It might be a bleb, it might be a capsule. How will I know where it is? Well, you do a chest CT scan wherein the body is, there's picture taken in every slice of the body. Tapos makikita mo yung itsura per level. So that's what they do in CT scan. So it can show a more detailed image of lungs, can be used for those with more complex lung lesions. If you want to operate, at least may idea ka ano yung takbo ng lungs. Can show a better image to differentiate other lungs lesions or tumors from the TB cavitary lesion. So it's good to differentiate yung iba't ibang tumors because different tumors have different density. So makikita rin yan sa CT scan. Oh, hindi pala to isang malaking tumor. Ano pala to? Bleb ng TB tapos may isa pang tumor. Ganun pala yon. So you will see that better CT scan kasi iba yung magiging itsura. However, the downside to this is it's expensive. So, yung common rate dito sa Metro Manila, mga nasa 3,600 to 4,200. Okay? Sometimes 5,000. So, expensive talaga yung CT scan. It's not usually done unless warranted or requested by the specialist, meaning maybe there's pleural effusion, not effusion, but maybe they need to map out the lungs of the patient. So, to map the chest, they map, sorry, not map, to map the chest, mamapa nila, they need to do chest CT scan para malaman nila, nasaan ba tong tumor na to, bleb ba to, ano ba to. Another test done is the sputum test, which is also a common test done. And this is actually a confirmatory test for tuberculosis. Once na nag-positive ka dito, sure kang may TB. Doon kasi sa x-ray, once na may nakita, TB ba yan? Active? Hindi? Pulmonya ba yan? Baka ibang infection yan. Diba? Ang daming question. Whereas with sputum test, once you test positive, for sure, you are positive for tuberculosis. So specifically, the sputum test can be two kinds. So, nandyan yung sputum AFB spear or acid-fast bacilli. And the other one, which is the latest, which is sputum TB gene expert, wherein they detect for the DNA of the TB bacteria in the sputum. So, yung DNA na doon sa sputum ang tinitingnan. So, mas sensitive yung sputum TB gene expert kesa sa AFB smear. Okay? So, yun. So, how do you do that? Well, when you're about to submit your phlegm or your sputum, you wake up. When you wake up in the morning, that's the first thing you do. Do not brush your teeth. Do not eat. Do not drink anything. Just spit the phlegm, hindi laway, the phlegm to the sample container given by the laboratory. And then, dati babalik ka the second day to spit again. Pero ngayon, you wait 1 hour, spit, that's the second sample. And then they will check. Does it have the bacteria through staining or through DNA or TB gene expert? Okay. When you do this sputum test, make sure that you submit your sputum within 30 minutes to 1 hour or else the sputum will expire. Ayan, so as I was saying, gene expert. So it detects the DNA of the Mycobacterium tuberculosis. It also can detect the resistance to rifampicin. Makikita kasi niya dun sa DNA na, itong TB ba na to, regular TB, or is this the TB that is XDR TB or resistant to medication or multi-drug resistant? So they will know based on the DNA that they will see in the gene expert. So this is also another gold standard for diagnosing TB, and it enables diagnosis of TB in patients visited by additional tests like sputum or x-ray. So since mas sensitive siya, it's gold standard. If you really suspect that patient has tuberculosis but the other test came out negative, then you can do one last attempt to check for the sputum gene expert kasi mas sensitive siya. What are the types and classifications of TB? So marami po palang klase yun. So yeah. So number 1 is pulmonary. So na-discuss ko na po yan kanina. You inhale that and it infects your lungs. That's why it's pulmonary. Primary, you inhale it, it affects your lungs. Your lungs not able to contain it, so you develop symptoms right then and there. Secondary, you inhale the TB. However, your strong immune system contains it, so you don't develop symptoms right then and there. But when your immune system goes down, it reactivates. That's secondary. Extrapulmonary naman is tuberculosis outside of the lungs. And these are the common ones. TB meningitis, when the TB is in the meninges or the linings of your brain. Pott's disease, when the TB is in the muscle, and not muscle, the bones of your vertebra. That's Pott's disease. And if not taken care of, compression, maiipit dahil ma-fracture yung vertebral body mo o yung gulugod mo. Another is the skeletal TB. Since may skeletal, kung may TB ka sa buto, what happens to your bones is it becomes weaker. And then there's genitourinary TB, like pwede ka pala magka-TB sa pantog. Yes. Diba? And there's GI TB or gastrointestinal TB. TB ka sa bituka mo. Pwede pala yon. Yes, okay? So, in other countries kasi, yung mga nagpa-pasture, yung mga ng cows, iniinom nila diretso yung gatas, walang pasteurization. So, nagkakaroon sila ng GI-TB. Pero yun naman, through ingestion of untreated cow's milk. Lymph node TB, this is common sa mga bata. Actually, yung second na common sa pulmonary. So, pinaka-common pulmonary, next common type of TB is lymph node TB na common sa mga bata, may mga kulani. And other forms. Nandyan yung TB salpingitis, so may TB ka doon sa may bridge ng matres mo. Diba? So, pwede pala yun. I had a patient when I was a clerk na akala talaga namin appendicitis. When we opened up that patient, turns out it's TB infection of the large intestine. Diba? So, yun. So, how do you classify TB? So, number 1, class 1, 1 to 5 kasi yan. Sa Pilipinas, unfortunately, walang class 0. Okay, once you're in the Philippines, you're from the Philippines, you've been living in the Philippines, hindi ka na class 0. Class 0 is no exposure to TB and not infected. Negative history of exposure, negative tuberculin skin test. Of course, the x-ray, the sputum test is also negative. Class 1, dyan tayo nagsisimula. There's exposure to TB but no evidence of exposure. We are all exposed because TB is very common in the Philippines. Why am I saying this? I'm not trying to promote na, hey, let's all have TB because it's trending. No. What I'm trying to say is because I want to break the stigma. Kasi when you say TB, ay, ano ba yan? Madumi, payat, mahirap. Di ba yun yung, especially in the 90s. So if you guys are 90s kids, may commercial sila noon na lalaki doon na nakalagay doon, babaero siya, tapos yung babae sumama sa ibang lalaki. May mga pinapakita sila doon na mga negative na ano. Tapos sa dulo, payat na matanda na hiyang-hiya sa sarili niya. Tapos nakalagay doon, may tuberculosis. Tapos yung ending ng commercial is, wag mong ikahiya yung tuberculosis mo, magpagamot ka. 'Di ba? Kasi may maraming, ang gusto nilang i-point out doon is, maraming bagay na dapat mong ikahiya. Pero yung pagkakaroon ng TB is not something you should be ashamed of and keep to yourself. Instead, go see a doctor and get treated. That's what I'm trying to say. I'm trying to break the stigma of, the negative stigma of TB na nakakadiri yan, ayaw na lang, nakakahiya, yung mga ganon. Kasi it can cost you your life. So lahat tayo dito sa Philippines, nasa class na tayo, we are exposed to tuberculosis. However, yung lowest level 1, kasi pwedeng wala tayong evidence of infection. So, pwedeng may history of exposure simply by coming here, by being here in the Philippines, that's already history of exposure. But when you do the tuberculin skin test, negative po siya. Okay? So, at least 10 weeks after exposure, negative. Less than 10 millimeters or 1 cm dito sa Philippines. Class 2 is, there is TB infection but no TB disease. Meaning, nag-positive ka sa tuberculin skin test, okay? However, the smears and the cultures, if done, yung sputum is negative. And then, there is no evidence of TB in the x-ray. So, yung kapatid ko, ganun. Yung bunso, nga sinabi ko, hindi niya alam may TB siya kung hindi dahil sa x-ray. And kaya din siya na x-ray noon. Hindi, na x-ray siya kasi requirement. Pero nag-skin test din siya, nag-positive. Ako nag-skin test negative. 'Di ba? So ako nasa class 1 ako. Ayaw ko lang ngayon. But anyway, so 'yun. Stage 3 or class 3 is current TB disease, meaning you have symptoms, you're positive for your sputum, positive in the x-ray. So yun, current TB disease, ongoing disease. Class 4 is previous TB disease, meaning you've had it before, but nagkaroon ka na ng scar sa lungs mo. So when you undergo chest x-ray, the previous scar is still visible. So ang example naman dyan, yung mother ko, naggamutan na siya nung dalaga siya. Pero nandun na yung permanent scar sa lungs niya. So every time papa-x-ray siya pag magta-travel, ina-explain niya na ano siya. So some people, they require her to do sputum test para lang sure. So abnormal na but stable yung x-ray. So nagkaroon na ng scar. However, negative sa culture and negative for evidence of current TB disease, meaning walang pneumonia, meron lang scar. Oo. Tapos positive pa rin siyempre sa skin. TB suspect or class 5, yan po yung you have signs and symptoms of tuberculosis but you haven't been assessed yet. Meaning, pinag-iisipan mo lang, may TB ba ako? So how do you get treated for tuberculosis? This is what we call yung DOTS or yung standard short course. Short course. Okay? So, sa standard short course, partida short course na to, it's actually 6 months. So it's not very short compared to other medication na 7 days lang, okay na. So with TB, it's actually total of 6 months treatment. The first 2 months is the time you get really weak kasi aggressive yung treatment. You take 4 medications at the same time. So may mga quadcom, fixcom 4, wherein there's a big tablet, and if you look at the pack, there's 4 types of medicines in there. So that's the HRZE or isoniazid, rifampicin, pyrazinamide, and ethambutol. You take all those 4 together 2 months. And then after 2 months, you go to the second regimen, which is the HR. You're now just taking isoniazid and rifampicin for an additional of 4 months. So dyan, medyo makakaluwag na yung katawan mo. So all in all, 6 months of treatment. So with the drug treatment, you need to be strict with your compliance or else the bacteria might develop resistance. And when it's resistant, dun na po yung problem. Okay, so there's 2 types of resistant TB. There's multi-drug resistant, that's resistant to rifampicin and isoniazid, and there's XDR TB that's resistant to 3 or more of the 6 classes of second-line drugs. So second line yung XDR, yung MDR yun yung main na rifampicin at isoniazid. So you need to be compliant with the treatment because if not, you can develop yung mas complicated, mahirap gamutin na tuberculosis. And how do you treat these? Mas maraming gamot, possibly mas mahal. Actually, yung TB yung HRZE or tsaka AR, libre yan sa TB dot. Pero kapag MDR ka na, XDR, may times na libre, may times na baka kailangan mo magdagdag ng bayad kasi mas ano na yung gamot, mas madami na. So TB DOT stands for Directly Observed Therapy Short Course. So ino-monitor yung mga tao that the healthcare workers make sure that they're taking the medication. And short course because it's only 6 months. The long course is actually, it can last for 2 years or 18 months. Okay, so I've had a patient who has MDR TB. Ang kanyang treatment is 18 months. 18 months siyang nagagamutan. So ang 6 months pala, maiksi na pala yun. So the strategy of TB DOTS is it's sponsored by the government. So the medication is free. Okay, the medication, the treatment, education, and all the other things that are involved in TB management is being given to the people through the local government units. Okay, diagnosis and the treatment for TB is scientifically based. It's based on diagnostic studies, like for example, sputum smear. Ayun. So, and then ensuring a definite supply of drugs, hindi yung naubusan ng gamot para sa mga tao. That is the TB DOTS project of our government. So, are there TB DOTS centers in our places? Yes. So, TB DOTS has been, ano na yan parang batas na yan. So, the government allots funding for it every year. So, there are TB DOTS centers that have medication in every municipality. In your place, you just need to go to the barangay health center or to ask your tanod kung nasaan yung nearest TB DOTS. Okay, so in the TB DOTS, that's where they give you free education about tuberculosis. So may mga pamphlets, they also give you counseling, and they also give you medications. Okay, nandiyan din yung mga testing. So, kailangan mo pa sputum test, sila na magfa-facilitate po noon. So, in our municipality, yung TB dots namin, masipag ako mag-refer dyan. Okay? So, yun. So, how do we prevent TB? So, there is a vaccine. Oh, meron palang vaccine. I want that. Unfortunately, the vaccine is only applicable for children. This is what we call the BCG vaccine. There is no vaccine to fight pulmonary TB in adults. Why? Because the vaccine is injected in the muscle or basically sa circulation na natin papasok yung vaccine. However, the bacteria can still enter the lungs. Pag pumunta siya sa lungs, yung defense ng katawan natin nasa level lang ng dugo. Hindi niya kayang labanan yung sa lungs. So you can still develop pulmonary TB. But the good thing about the vaccine, the BCG vaccine, is that it will protect your body from having extrapulmonary TB. Okay? Pwede ba mga bata dyan? Yes. Binibigay natin yan sa mga newborn. Part na po yan ng SOP yan pag may newborn. Pwede sa matanda? Yes. Pwede rin po to sa matanda. Lalo na kung hindi pa po kayo nagka-BCG before. So it stands for Bonifacio Global City. No, I'm just kidding. BCG, hindi siya BGC. BCG is Bacille Clamet Guerin. Okay? It helps protect children from complex TB or extrapulmonary tuberculosis. Kasi mahina pa ang immune system ng mga bata. So if they get primary complex at wala silang BCG, it can also go to other organs. So the effect of BCG is to the rest of the, para ma-contain lang sa lungs yung TB bacteria. Okay? So it also provides some protection against severe forms of pediatric pulmonary tuberculosis. It's unreliable against adult pulmonary TB kasi hanggang dugo lang siya. Hindi na siya makakapunta talaga sa lungs. Okay? So it offers protection against extrapulmonary tuberculosis even in adults as long as you are HIV negative. Because if you have HIV, your immune system is compromised, so possible na hindi rin siya maging effective. Okay, other ways to prevent tuberculosis, ito mga simple ways that we can do in the office and in our house is ventilation. Make sure na bubuksan niyo yung mga bintana niyo every now and then para mag-circulate yung hangin. So, the spread of TB is less in areas with constant airflow or good ventilation. As I said, air conditioning is not ventilation because the air is just being cooled, but it's not really circulating outside of the room. Diba? So air conditioning is not ventilation. Ventilation is opening your windows and your doors. Natural light. So natural light or UV, as I said earlier, can kill TB bacteria. Yun din yung reason kung ba't bubuksan mo yung hangin para kung merong TB bacteria sa hangin sa loob ng bahay nyo, pag naihipan yan at lumabas, mapapatay yan ng UV light. Diba? So yun. So, nadidilute mo yung maruming hangin. For example, merong may TB, madidilute mo yung maruming hangin na may droplets niya. Okay? Early detection is also important. So, the earlier you detect, the earlier the treatment, hindi pa nangihina yung katawan mo, mas magiging responsive ka sa medication. So, how would I start? Ano pwede kong isipin? What should I think na consider ko na yung TB? Well, as I said, number 1, 2 weeks na may cough ka na, more than 2 weeks. 2 weeks of cough, 2 weeks of fever. Yun ang mga clues natin na baka you need to go check a doctor and consider tuberculosis. Other prevention when it comes to social etiquettes, please avoid spitting in public. Wear a mask when you are sick. Pag inuubo ka, uso naman yan dito ngayon kasi because of the pandemic, we are all required to wear a mask. So that's good. Practice hand and body hygiene. So make sure that you wash your hands all the time. Make sure that you wash your hands when you eat, before you eat, after you eat, before and after you go to the bathroom, and then take a bath every day. Cover your mouth and nose when you cough. Ideally, when you cover your mouth and nose when you cough or sneeze, you cover with a flexed elbow so that your hand will not get contaminated, diba? So yun. And then dispose of used tissues or napkins properly. Make sure na ilagay sa basurahan. Don't just leave it lying around. Baka may mahawa din through that. Make your immune system strong by practicing healthy habits like eating balanced diet with proteins, fats, carbohydrates, water, fiber. Exercise regularly it helps strengthen your lungs. Sleep right kasi when you're sleeping, that's when your immune system repairs itself. That's when your immune system creates more immune cells. So sleep right, 6 to 8 a day. quit smoking kasi smoking damages your lungs, it makes your lungs weaker. So mas susceptible ka sa tuberculosis. So sabi nga nila, when you are a smoker, mas susceptible ka sa TB because the chemicals from the smoke weakens your lungs. Therefore, in TB management, smoking cessation is part of the treatment. So tinuturuan din yung mga tao na naninigarilyo na tinutulungan silang mag-stop. With the COVID naman, it has been seen that so of course, dun sa mga iba na nagka-TB before and then nagkaroon sila ng COVID, mas at risk sila for severe COVID kasi meron ng injury sa lungs nila kasi may scar na. So yun. So tuberculosis prevention tips, ito lang summary poster. Cough for more than 2 weeks, fever or night sweats for more than 2 weeks, pa-consult na po kayo sa doctor. Okay? Or when in doubt, kahit wala pang 2 weeks, pa-check up po kayo, 'di ba? When you sneeze or you cough, cover your mouth with your hands, your flex elbow, your tissue, and throw it in the trash. Practice good hygiene. Prevent the spread by making sure that you get medical treatment as soon as possible and practicing hand washing and body hygiene. So my take-home message is, TB is sadly very common in the Philippines. However, ganyan talaga ang buhay. This is a tropical country. Since it's very common, we should not discriminate against people who have tuberculosis. Okay? When you feel that you might be sick and you want to TB or consult a doctor, please do not self-diagnose yourself. And when you are treated or when you have been diagnosed with TB and given a prescription medication, make sure that you take that medication as instructed, comply, finish the regimen, do not go halfway. Okay? TB is only deadly if neglected. Okay? So that's it for this afternoon. Thank you for watching.
Thank you, Dr. Macy, for that very thorough presentation. So let's give our speaker a virtual round of applause. Thank you. It has been very comprehensive. No, most of the questions that we received were already addressed, but we'll read them as well. So we invite you to send questions in the chat box. And for those who wish to go over the sessions, this session of Dr. Macy, you can watch through our Facebook page. We will have a recording there later. So send the link in our chat box now. So we'll be reading first the questions we received ahead through the registration link. So commonly saying na tuyuan ng pawis, Dr. Is this true as a factor for TB?
Oh, okay. So yung natuyuan ng pawis, actually, magandang question kasi sa culture natin, di ba, naglalagay ng towel sa likod. It's not really, studies have shown that it doesn't really do anything with infection of pneumonia or TB or anything, any lung infection. However, you can say na may katotohanan din siya kasi kapag nalamigan yung tao, ang tendency, lalo na kung ginaw na ginaw ka, ang tendency yung immune system mo kasi is bumababa. So, kasi hindi siya makasirculate na maayos, giniginaw. So, since medyo nagwi-weaken yung immune system, maybe that's the reason na pinagpulutan ng mga ancestors natin dun sa saying na yun na pag natuyuan ng pawis kasi giniginaw ka. And pag giniginaw ka, your immune system goes down. And that's the time na madali kang ma-infect ng not just TB but other pulmonary or other infectious diseases.
Okay, thank you, Dr. You mentioned earlier the effect of smoking. So the question here is, does smoking trigger tuberculosis? Sorry, Nancy.
Oh. Hello.
Did you-
Ayan,
yeah,
I wasn't able to pick it up. I
Ayan.
think
The question,
I think I was unstable.
yes, it's okay. So the question is, does smoking trigger tuberculosis?
So it doesn't trigger tuberculosis, but it makes your lungs weaker, so you are more susceptible to having tuberculosis, other lung disease, COVID, for example, or asthma. Diba? So it will not trigger, but it will make you more susceptible.
Thank you, Dr. I think you also mentioned earlier how it can be very contagious and how your family members can have it, but someone can be immune to it based on the strength of the immune system nga po. But the question here naman po is, are there early signs of TB as an infection po?
So yung pinakaano talaga is yung 2 weeks of cough. Kasi before that, it can be anything else. Common cough can be COVID, it can be something else. But if it's more than 2 weeks, you have to start considering TB. Pero yung early signs, let's say yung adult TB or yung intubation, there are no symptoms, but if you get yung x-ray, doon mo makikita na may sign ka pala ng TB kahit wala kang symptoms, may scar ka sa lungs mo, wala ka namang history ng TB treatment. So, baka may TB ako ngayon na untreated kasi may scar ako sa lungs. So, yun yung isang that's why chest x-ray is very important. Important yun na, di ba, sa mga companies na nagpapa-APE tayo every year. Kasi common ang TB dito. And sometimes it's undiagnosed if not for the x-ray that is being done every year.
Yes, and then probably connecting that to another question, what is the validity of an X-ray? Because some employees or some patients would really want to refuse kung kaka-X-ray lang daw nila or baka pwede pa yung last na X-ray nila po.
So when it comes to TB, I'm not sure kasi walang hard and fast rules, pero parang 1 year, dapat once a year nagpapa-X-ray ka. That's if I remember it correctly from the DOH, at least once a year nagpapa-X-ray ka. Kaya yung mga companies, yung schools, they require that sa mga students, employees. Once a year nagpapa-X-ray ka. Or, so, di ba, kung wala kang symptom, at least once a year pa-X-ray ka. Unless nagka-symptom ka, and then kailangan mo magpa-X-ray. So, let's say nagpa-X-ray ako ng January, wala pa namang 1 year, pero inuubo ka ngayon. You're having fever now. Sabi ng doktor, pa-X-ray ka. Kailangan mo magpa-X-ray. So, if there is any signs, symptoms, or change in your health status, kailangan mo magpa-X-ray kahit wala pang 1 year, yung last X-ray.
Okay, fine. Thank you, Dr. Connected also to that, as an X-ray finding, how can we differentiate TB as a scar and TB that needs treatment? I think this is related to the story that you shared, Dr. Na wala
Yes.
pong symptoms sa family pero meron silang finding.
Yeah, so yung sa mother ko naman, yun yung kanya. So she had TB when she was younger, dalaga pa siya. And so nagkaroon siya ng scar. Yung scar na yun, every time papa-X-ray siya, lumalabas. So yung mga agencies na, kunyari, mga nag-apply ka sa visa or sa hospital, may bago siyang boss na hindi alam na meron talaga siyang scar, pinapa-sputum test siya, ganun. Because there's really no way to detect. There's really no way. Lalo na kung kunyari, ito po yung proof. Meron akong certificate na natapos po yung 6 months. Minsan kasi, okay, you have proof na natapos mo yung 6 months. That was like 5 years ago, 10 years ago. What if nagkaroon ka na naman ng TB, hindi mo alam? So, yung ginagawa ng iba, lalo na yung stricto, nagpapasputum pa din, sputum test. Kasi really, by just looking at the x-ray, you will not be able to tell if it is a current infection or disease or its previous scar. So, yun.
Okay. Dr. Also related to that, can a child with the past TB infection have the X-ray in his or her X-ray until she grows old, or he or she grows old?
Yes. So yung scar, yes, it is lifelong. So yung brother ko, so siya yung bunso namin, siya yung pinakabatang nagka-TB sa family. I think he had TB at the age of 10 or 9. Hanggang ngayon may scar pa din siya, 30 plus na siya. However, mayroong mga tao naman na, bakit parang wala na akong scar? Nawawala din or may bago sila. Pero very rare na mawala. Talagang habang buhay na po yan.
Okay. So you should really take care na to keep ourselves healthy para hindi makapag-contract ng disease. Okay. We have here one question relating to the sputum test. Why 1 hour lang po to submit the sputum test? Hindi po ba the bacteria can stay alive for several days if without sunlight?
Okay. So, once na nag-produce ka na ng sputum in the morning,
Yeah, let's wait for Dr. Nancy. Nawala yata siya. I think it's
yeah,
beginning to
hello,
ring.
sorry. I think, I think that's
Yeah.
my connection. So anyway, so yeah, if I understand it correctly, bakit 1 hour? Kasi pwedeng makontaminate with other bacteria.
Mhm.
When you submit the sputum, your saliva is all the normal flora of your mouth and your airways. So kapag naghintay ka na ng matagal, baka masapawan na ng ibang bacteria, yung contaminate na yung sputum sample. So that's why you need to submit your sputum immediately para malinis pa rin siya relatively. Yung TB na lang talaga yung makikita nila. Walang contamination ng other bacteria. And then, by 1 hour, then, kasi, di ba, you submit the first sample and then wait 1 hour, submit the second sample. Previous, the, uh, ayan,
Go
I'm
ahead,
sorry
Dr.
again. But
Ayan.
yeah, as I was saying na, marami kasing na lost follow-up kapag hinintay pa ng 1 day yung second sputum sample. Kaya ang ginawa na ng government is after 1 hour on the same day, you submit the second sample.
Okay. Thank you, Dr. We've touched on the X-ray if mawawala na kahit may medication. Here's another question. Does e-cigarettes or vaping affect also the
Okay. So, ganito kasi sa vape, are juices. Tawag kasi nila doon is juice. There are juices na alam mo malinis. Alam mo na pure yung chemicals niya. Okay siya. However, there are also juices that you don't know what's in there. It can be dangerous chemicals the same as the cigarette, 'di ba? So, hindi kasi siya regulated. The juice that you use for the e-cig is not regulated. Like in America, there was an incident where there were children, kasi parang uso sa mga teenagers na nagbe-vape, and they develop pulmonary, anong tawag doon? Acute respiratory failure because of the juice that they use. So, hindi natin alam kung yung juice ba na yan ay safe, malinis, or hindi. So, pero it's safe to say, doon tayo sa maingat na side, on the conservative side, na may danger pa din. 'Di ba? May danger pa rin. Pero kumpara sa cigarette, sabi nila, mas safe siya. Pero nandyan pa rin yung danger kasi hindi mo alam yung contents ng juices. So ano talaga yung pinaka-safe? Walang smoking, walang e-cig. Talagang natural na hangin lang yung hinihinga mo.
So yeah, lesson for those who are vaping. So Dr. There's another question. How do we know that the patient is no longer infectious?
Okay, so if for example, you are already taking TB medications for anymore. But prior to that, let's say na inuubo ka pa lang, you haven't started your medication, or you haven't taken your medication for more than 2 weeks, you are considered infectious and you should isolate yourself from other people, especially the young ones and the old ones. But yes, you are rendered non-infectious if you're taking medications as instructed for more than 2 weeks already.
So it's important to start treatment immediately. This is related to another question. If What is recommended protocol, if any, of the family member if diagnosed with TB? Should the TB patient be isolated during treatment?
Sorry, can you repeat that again?
What is the recommended protocol for the family if a member is diagnosed with TB? Should the TB patient be isolated?
Yes. So ideally, that patient should be isolated at least until that person is able to complete at least 2 weeks of treatment. Pero hindi 2 weeks lang ang treatment niya, ha. So once na naka 2 weeks na siya ng medication, pwede na siyang sumali sa inyo. Pero tutuloy pa rin niya yung medication niya for 6 months. Okay? Rendered non-infectious lang siya once na naka more than 6 months more than 2 months. Sorry. Rendered non-infectious siya pag more than 2 weeks of medication na siya. And given na sinusunod niya yung tamang pag-inom ng gamot. Other than that, prior to that, you should separate yourself from the rest of the family. Unless yung family members mo nag-positive din. So, sabay-sabay kayo mag-take ng gamot. So, hindi kailangan maghiwalay kasi lahat pala kayo meron, di ba? So, yun. But yes, kung ikaw lang ang nag-positive, the rest ay negative, at least maka 2 weeks ka na medication before you join them again.
Okay. Noted, Dr. So here's another question. What is your thoughts in having bilateral infiltrates in X-ray and the sputum is negative? Can we consider it as PTP? Clinician na to. Pinapadiagnose nila daw.
Actually, so it depends saan yung infiltrates. Pero hindi lang naman po TB yung makikitaan mo ng infiltrates sa X-ray. There's COVID, there's pneumonia, there is heart congestion, yung pag nagkaroon ka ng heart failure, you have congestion in your lungs, magkakaroon din yan ng haziness. So there's a lot of other diseases that will show haziness or infiltrates in your chest X-ray, not necessarily TB agad. As a clinician, kami nila doc, we look at the bigger picture. We don't look at just the X-ray. We don't look at just the sputum exam or just the interview lang, walang physical exam. No, we correlate everything, the history, physical exam, presentation of the patient, and then yung mga lab exams, yung imaging studies. We correlate that, and that's how we come up with the diagnosis. It's not just na hard and fast rule na, pag ganito, ganyan. Ano yan kailangan, ano mo yan itimpla mo siya kung ano yung, para malaman mo kung ano talaga yung diagnosis.
To correlate everything, Dr.
Yes.
Apo. So here's another question naman po. Is there a law that protects or covers an employee diagnosed with TB and needs to undergo treatment? Will the employee need to file a medical leave? I think si Dr. familiar as a company doctor.
So yes, you are protected as an employee. May batas tayo for that. I just forgot the name, yung number ng batas. Pero yes, and then also, kaya din may TB dots kasi there are small companies na hindi nila kayang i-cover yung gamot. So, nandyan yung TB dots, i-connect ka nila sa LGU tapos para hindi ka gagastos. Pero may mga companies din na kino-cover nila. Swerte mo na lang, di ba? Although alam naman nila na bakit pa may libre naman sa LGU. So, even if the company does not cover it, their LGU gives out free treatment, di ba? All you need to do is connect with them. And just because you have tuberculosis, hindi yan grounds for being fired from your work. Okay, may batas na poprotektahan ka dyan. Sabihin natin nag-absent ka for 2 weeks kasi nagagamutan ka for TB, hindi ka pwedeng masisante because that is your right na magpagaling. Okay, hindi nila pwedeng gawing excuse yan. So just because absent ka for 2 weeks pero may valid medical reason ka, you're getting treatment for TB, you're not supposed to get fired.
Of course, Dr. They have to also coordinate with their HR.
Yes,
kasi
of
baka biglang
course.
umabsent lang.
Opo, yes, inform inform your
Yes.
HR of your status. Oo nga naman, tama nga naman.
Yes, kasi that's also important that they present their certificate, and even if it's longer than 2 weeks na, Dr., I think it will be honored. And if it's beyond as a company physician also before, if it's beyond your leave credits, it will be paid by SSS separately.
Yes.
So you can claim sa sickness benefit. Ayan. So here's another question. Siguro we'll have the last three questions kasi overtime na tayo. We've spent so much with Dr. Anaysi. So a patient with post disease last 6 years ago healed na po in 2018. What will be the preventive measures that they can do since there was already the infection before?
Okay, so with Pott's disease, when you say healed, the bacteria is not there anymore. However, the bone is not as strong as before kasi kinakain ng bacteria yung buto, yung vertebral body, yung gulugod. So, with people with Pott's disease, kailangan maingat sila, especially in doing manual labor, kasi kahit na wala ng bacteria, wala na yung infection, the bone is not as strong. Pwedeng butas-butas na yan, brittle na siya. So, hindi sila pwedeng magbuhat ng mabigat, avoid contact sports kasi ano siya parang imagine mo para silang may osteoporosis, mahina na yung gulugod nila because of the previous infection. So yun nga, mga strenuous activities, they need to be careful, they cannot lift heavy objects. They can still exercise pero it should be guided by a healthcare profession, hindi lang yung professional like for example fitness instructor, ideally physical therapist para alam nila yung tamang exercise to strengthen your muscle while protecting your spine. So basically to sum it up, bawal talaga yung magbuhat ng mabigat, bawal contact sport, bawal mahulog, bawal madulas kasi baka magtuloy siya as spinal cord compression.
Maybe, Doctor, you can also mention, I think this was also tackled in your lecture, but emphasize on this way to strengthen the immune system po.
Yes, opo. Para hindi maulit. Para hindi maulit yung infection.
So this involves, of course, diet and exercise and proper sleep, enough rest. Okay. So a last question, is there home remedy for TB? Siguro yung mga herbal to, Doctora, or any suggested treatment?
When you say home remedy, is that to treat TB? Wala po. Kasi actually sa totoo lang, yung medication that we give the patients, yung HRZE, yung 4 medications, ang tawag doon technically is chemotherapy na kasi it's 4 different medications combined. So parang pasok na siya sa criteria ng chemotherapy kasi ganun kalakas yung TB. So herbal medications and other home remedies. Kung isang gamot hindi kaya yung TB, paano pa kaya yung mga herbal? So, but home remedy to prevent TB, yung natural ways of making sure that your immune system is strong, wear a mask, yung mga ganun. That can be to prevent. Pero to treat, wala po.
Okay, so ayan, I think that sums up our lecture. We have covered so much in the last hour. But before we close this session, maybe we'd like to hear some final words from Dr. Lucy for our participants.
Ayan, so first of all, thank you for inviting me to talk this afternoon. And hopefully you guys are able to learn a lot. And our goal really is so that you guys will not become paranoid, you will not overdiagnose, underdiagnose yourself, you will stay conscious or keep in mind the proper way to stay healthy, especially in fighting tuberculosis. So take home message, keep yourselves healthy, immune system strong by eating healthy, exercising, sleeping right, avoiding people who are sick, but if it's unavoidable, wear a mask, protect yourself, and stay strong and healthy, everyone. Thank you.
Okay, thank you so much, Dr. Macy. There you have it. We have concluded our session on TB in the workplace. So we hope you have learned, we both all have learned from this webinar, especially in keeping our lungs healthy. So we also invite you to join our future webinars. Before we go, on September 13, we will have this webinar entitled Options in Restoring Your Smile, Modern Trends in Replacing Lost Teeth. So we will be sending out invitations through emails and our social media pages. This is through our dental services, Medicare Dental, Health Beyond Smile. So please join us in this next webinar. So that's all for this afternoon. Hope you enjoyed our session. Until we see you again in our next webinar. Goodbye, everyone, and stay safe.
pass by with a multitude of changes, and every day can pass.
All new places, different faces in a world where changes everywhere you turn.
Find a friend you can rely on.
Hold the helping hand that shares. Keep the company that will truly care. The company that doctors build. The caring and the expertise. We're here
to serve you through the years.